This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm TG LaFredo, and this week on the program, my guest is Stormie Beckerle. She's a bereavement counselor at KRMC Hospice. Stormie, welcome.
Thank you for having me.
Yeah, thank you. I'm excited to be here. We're going to talk about the many facets of KRMC Hospice and what you do as a bereavement counselor. Also, I was looking at your resume. You have a fascinating background in mental health and counseling. So let's talk about that. You've served as a counselor in many capacities. Can you tell me a little bit about some of those different chapters?
So in the beginning of my career, I worked with those that have psychotic disorders, and of course, substance abuse goes hand in hand with that. Moved into crisis work because I was very comfortable in that realm and I wanted to expand my knowledge. And then I was actually a director of a psychiatric hospital for a while. And when they did close down, I was looking for my next challenge, and KRMC had an opening to create the bereavement program and get it restarted, and here I am.
Okay. I want to talk about what brought you here specifically, but you have to tell me a little bit about trying to operate a psychiatric hospital. The patients would have been... what were they there for? Most
of them, psychotic disorders, substance abuse. The majority, they were homeless, of course. Yeah. And so it wasn't hard to keep it full, so to speak. Yeah. There's a huge need in this area, and there aren't enough resources. So yeah, it was beautifully tragic.
Yeah. Was it dangerous work?
It could be at times. There's a misconception that everyone who is psychotic is dangerous. Not all of them are. Some of them are just beautifully broken people.
By this point in your career, do you feel like you know how to spot when something's going to go sideways? Or?
Absolutely. I've been doing this close to 2 decades now, and I've only been assaulted twice.
Only? This is once every 10 years. This is pretty good, right?
That's a pretty good track record. So,
were those serious incidents?
No, not at all, luckily.
So when you were ready to make the change, you found out that there was a position here. Yeah. KRMC Hospice is so different in nature, I would think.
Well, you're still, you're working with people that are going through one of the most challenging times in their lives still. Yeah. So there's still this level of crisis and trauma that transcends. It's just different circumstances.
You've been working in counseling in various capacities for about 2 decades. If I may ask, when you look way back, what was it that initially, what was the call for you? What was your interest in this field? So my uncle, he was diagnosed as a paranoid schizophrenic when he was 15, and he was able to hold down a job. He understood his mental illness. He was functional. He led a very normal life, and it intrigued me. I wanted to know why and how, and why some can and some can't. Even as a kid, you were aware of his condition?
Absolutely, yes. It was never something that was hidden from us.
Did he had episodes where he was not managing it well? Or?
Oh, yeah. Yeah. Yep, he would go into dark, deep depressive states where he would isolate for months at a time. Yeah. So,
in your education and your training, obviously, you gained insight into his condition. Yeah. When you look back, does it make sense? Now, I say that in quotation marks, right?
Yes. You kind of understand the overview, so to speak, of, this is your uncle, he's got this, going on. And as a kid, you're like, oh, okay, he does this and this. But then when you kind of put it together, it's almost like watching A Beautiful Mind, the movie, so to speak, where, he starts to kind of get the delusions and the paranoia and things. And it just gives you this aha moment where it all comes together and you're like, that's why. Yeah. That's what's going on in his mind.
When you were in the working in the hospital context, you had many patients who were in a similar situation, right?
Yes.
When you're talking with those folks day in and day out, do you kind of question your own sense of reality?
I think it just reaffirms your sense of reality instead of questioning it. Quite often, just because some of them are so far out there and some of their thinking. So, yeah.
Well, let's come back to the work you do here at KRMC Hospice. You work with clients and families in many different capacities. One is one-on-one counseling. Yep. Say a little bit about that. How does that work?
So we are a free service provided to bereavement clients. As long as, you have lost a loved one, we can do the bereavement counseling. You just give us a call, ask for an appointment, show up to some of our open share groups. There are many ways that we try to make people feel welcome to come in and seek the healing that they need.
Yeah, you have a variety of specialized groups. What are some examples?
We do. We have a faith-based widows group that is actually written by widows for widows. I felt it was inauthentic for me to try to run a group with something that deep that I had not experienced myself. So I found Stand in the Gap. And this is a full program. It's amazing. So I highly suggest widows check it out no matter where they are. We have non-denominational groups that will support you in any way, that it's a much, broader spectrum. We have a men's group as well, a widowers group. And we have socialization groups that are peer-run. Coffee is Thursdays at 10, and it's literally a socialization group. You get coffee, you get some yummy dessert made by our famous Jan, who does our baking. She's amazing. And we have soup dinners, especially in the beginning. It's hard. You don't want to eat alone. You don't even know what to cook anymore. So come on down and have a bowl of soup and sit with other people that, are literally in the same chair.
You mentioned open share groups. I'm not familiar with the term. What does that mean? So
that's literally, you could have lost anyone. Child, spouse, aunt, uncle, parents, friend, you name it. Yeah. And so it's a very non-structured group where he or she will just walk in, or they will just walk in, grab a seat, and you can share about anything. Yeah. So like the widower and the widows groups are very structured. Yeah. They're, each week has a specific topic that we're going to go over, and we work through kind of like packets, whereas the open share group is literally just that, for someone who just needs to come and let it out. So
you mentioned a couple of faith-based or faith-adjacent groups. When we experience loss, we often think about our place in the cosmos.
Yep.
Still, there are people who are not religious. Are there offerings for them as well?
Always. Yeah, we offer something for everybody.
You have some special events, Mother's Day.
Yes. So we try to do things that are fun. Bereavement doesn't always have to be about crying and feeling sad and missing your loved one deeply, and that's the only focus. Things like the Mother's Day tea party we do to honor our mothers, our sisters, our daughters, the women in our lives that we've lost. So we dress up in silly tea hats and have crumpets and tea and we literally have a tea party.
You have a Father's Day chili cook-off?
Yes, we do. So, of course, you have to have your food handler's card and so forth. Okay. But so, yes, there's a select group of us that make chili for the dads, and they get to choose who wins the chili cook-off.
I was going to say, chili will get the dads up and moving around, right?
Yeah, and they love it. I've had that be the breakthrough moment that men start actually coming. They'll come for a bowl of chili and be like, oh, okay, I can do this.
This isn't so bad.
Yeah.
Grief, I mean, you mentioned the importance of having some lighter, some happier experiences, right?
Yeah.
And I feel like I don't have any training on this, but grief comes in waves where
Oh, absolutely.
you have brighter days and you have darker days.
Yep. Very true. And that's why we've got so many different offerings for that as well. We do like a scrapbooking art group on Wednesday nights at 4. And so, that one you can come in and be happy or sad for that one, because it's a roller coaster. You can go through all of the different phases of grief, some of them at the same time even. You'll be walking along fine a year or two later, and then all of a sudden a butterfly will come by and you're bawling like a baby again, and you don't know why.
These moments that sneak up on you.
Oh, absolutely. Yep.
I know that group sessions are a cornerstone of counseling. Let me ask a naive question. How do they help? Why are they significant?
So everybody's always in a different place with their own grief. I mean, we know that the stages of grief are the same, but everybody experiences them differently. Everybody's got different coping skills, different support systems. Group sessions help in so many ways. They help in just providing a social aspect. You can literally come in just to be around other people who know what you're going through, and you don't have to say a thing. You can come in and share your stories of grief and healing, which will help the newcomers kind of see like, oh, I can, she's getting through it this way. I can do it too. So learning from other people's experiences, surviving grief is hard to come to grips with. The new life, the identity crisis that happens quite often because your whole life changes without that person. And I've had a lot of people come to me just for me to tell them, no, you're not crazy. This is real and it hurts. And you're going through the normal stages and you're doing good even though it doesn't feel like it.
If you're just joining us, this is Focus on Your Health. I'm TG LaFredo, and this week on the program, my guest is Stormie Beckerle. She's a bereavement counselor at KRMC Hospice. And Stormie, when we were first chatting about this interview, you said, there's a myth that I hear all the time in hospice. I want to make sure we talk about that.
Yes. So a lot of families are under the impression that when they're signing up their loved one to be on hospice, it means that they're not going to make it very long. They think that they're going to pass within a day or two, among other misconceptions. So we've got clients that have been on hospice 2 years at some points, a year or two. So just because someone comes on hospice doesn't mean that their time's up. It just means that we are going to give them the care and the compassion and death with dignity at this point, make them comfortable, ensure the family has the time that they need with them. They're going to have nurses come more often. They're going to have more support with the CNAs and the LNAs helping out as well. So we're just a big support network for the family.
Yeah, I think we're going to be getting this message across more as well. I have upcoming hospice interviews. In fact, later today, I'm speaking with your colleague, Dr. Carleen Adams. She is in palliative medicine, meaning she cares for folks who are nearing the end of their lives. But again, just because someone's on hospice, it doesn't mean we're withdrawing care. It doesn't mean we, these misconceptions come up all the time, right?
Yep, they really do. And so some people end up with regrets as far as, I wish I would have, or I should have, put them on hospice sooner, when they realize that, just because, they're on hospice doesn't mean, like I said, they're not going to make it more than a few days. So, we have a lot of people that are up, we call them walkie-talkie. They're walking and they're talking and they're going on vacation to California to see the grandbabies. And, they do all the things, but it's just a little bit more intensive care. We're going to make sure that they've got their medications. We're going to be more attentive to making sure that they have oxygen when they need it and where they need it. even supplies too. We provide a lot of the supplies. So it's not like hospices, we're going to throw them in a bed, fill them full of morphine, and take away their oxygen, because it does not work that way.
Right.
So, but I've literally word for word heard that, perception of hospice.
So important to make that point.
Yes.
One of my favorite things about doing these interviews with medical professionals, counseling professionals, is I get free consultations.
Yes, you do.
So Stormie, let me put you on the spot for a moment. Okay. I want to run a scenario by you, and I think it's not just selfish. It may be a little, but I think probably plenty of listeners could relate to this. I have a dear friend whose father-in-law is in poor health. And it's a difficult situation. It seems that half the family understands this gentleman is nearing his final days, and the other half is really angry and in denial. And anytime he has a setback, they respond with blame and threats. In fact, just recently I talked to my buddy, and he was like, it looks like we have to get a lawyer because. So this has to do with power of attorney and questions of how much they're really caring for him. Anyway, it's a mess. And so first question, is this sort of thing common for families who are approaching or dealing with a loss?
Oh, this is extremely common. Family conflicts like this happen all the time. I think that education and family meetings with nurses, doctors, counselors, social workers really make a difference, because the ones that are angry and in denial, they're moving through their stages of grief already. They're working through the fact that they may not be passing right now still, but it's coming. Yeah. And they don't want to accept that. And so therefore they're going to fight to maybe do some things that aren't necessarily best.
It's really arriving at the worst possible time.
Absolutely.
I mean, they need to pull together. They have the opportunity to support one another, but instead they're in factions.
Yes, so that's, like I said, that's where the education and the family meetings come in. Educate on the disease process, which, our nurses are amazing when it comes to just discussing what the disease is, how it's going to progress, what it's going to look like as your loved one transitions into the active dying phase throughout time, how the body is going to react. So to have the family educated at the same time and have those concerns brought to the professionals, I think really helps mitigate some of those concerns. And it gives them the ability to ask the professionals the question.
Yeah. When I imagine your role as a bereavement counselor here, I think about the image that I have in mind is someone coming in and saying, I lost this loved one. It's so hard. It's, the days are long and painful. I didn't think so much about you having to kind of talk with one half of the family and talk with another, as in this case. Does that happen pretty regularly for you?
Less regularly for me, but more regularly for our social worker.
Social work side,
Because we have an amazing social worker, Crystal, who is just very compassionate and helps lead these kind of meetings all the time. She brings families together and definitely, it's almost like a marriage family therapist role that she has to morph into at times to help ensure that, that the family and the loved one can have as much peace around the death as possible.
Over the years, I've visited this building, KRMC Hospice, the Joan and Diana Hospice Home, many times, and I've made this observation on the radio before, but when I walk in, there's just a feeling about the place. That is nothing against any of the other facilities on campus, but this one feels different.
We try to make it feel like home, honestly. We have a family room, we have a reflection room, coloring books and board games, and Olivia's amazing cookies. Oh, you have to have one of Olivia's cookies if you come. But, this place is about family. And we've had these beautiful moments where, you have to step over grandkids in the patient's room because they've got sleeping bags on the floor and everybody's there with grandpa, and we let them. You want to stay the night, we'll order you a comfort cart, and it's got bottled water and whatnot, and the whole family can be there with less restriction than a hospital as well. You're limited to 2 visitors. Well, as long as it's quiet, and everybody's respectful, then absolutely, everybody can come and laugh and tell stories and make the transition a beautiful thing.
I've been thinking about this quite a bit lately. Stories. I just want to follow up on that. I just feel like stories are so important in healing. Can you say a little bit about that? Can you support my thesis?
Oh, absolutely. The scrapbooking group.
Yeah.
We do healing through memories with that scrapbooking group. So, you pull out an old picture and you remember the time and what you were doing and who did what, and you laugh and you cry at the same time a lot of the times. And you make these books that are nothing but stories. They're your life story, and you get to share those healing moments with those around you.
You were gracious in sharing your background and your history in counseling. Mm-hmm. I have another potentially personal question, if I may. In your work, you often deal with loss, of course, and according to the National Institutes of Health, in hospice and palliative care settings, and this is a quote, a recent systematic review established that 27% of social workers demonstrated burnout, while 15.1% of physicians and 18.6% of nurses experienced burnout. So while families need care in hospice, the hospice staff needs care as well. How do you see to that?
I have an open door policy. Part of my job duties are actually staff support. So when they're struggling, when they're frustrated, when they're hurting, because they're human too, they're going to cry when your loved one dies. Because we are human at the end of the day, and we do have those emotions, and we do get attached to people. So, so I've got a very strong open door policy that you can come in, you can talk with me at any time. As well, I do bereavement counseling for those that have lost their own loved ones that are staff as well, because it's hard to come to work after you just lost your uncle, your husband, your child. Most of them, they'll be like, oh my gosh, I need to talk. I'll get a text or a phone call or whatnot. And, we make time that very day, usually within an hour, and we address it right there in the moment. And it's very helpful.
Are you ever not a counselor? If you and I go and grab a bottle of water or something and go for a walk, are you working on me?
Yeah, no. No, I try not to.
Yeah.
In the beginning, absolutely.
Right.
Beginning of my career. Now, no. Yeah. No, I try very hard to shut that off and just differentiate work me from home me.
Yeah. Yeah.
So.
Stormie, what is ahead for you and for KRMC Hospice?
I can't speak for all of hospice, but I can say that I look forward to growing this program. I want to continue to identifying the needs of the community, the ways to meet those needs for the community, and stay creative in how to help serve our patients.
Stormie, it was such a pleasure to talk with you. Keep us posted. Will you check back? Can I check back with you and hear about how those programs have grown?
Oh, absolutely. Yes.
That is Stormie Beckerle. She is a bereavement counselor with KRMC Hospice. And for more information on programs here and on hospice care, you can call KRMC Hospice at 928-692-4680. That's 692-4680. Stormie, thank you so much for your time today.
Like I said, thank you for having me, and thank you for helping share the knowledge of KRMC Hospice.
And that is another edition of Focus on Your Health. I'm TG LaFredo, and thank you for listening. We'll catch you next time.